Hello, my name is Michael McCoy, and I am going to be performing your HIPAA Compliance Officer training today. This is going to be a very fast-paced training because there's lots for you to learn and even more for you to implement. So let's get started. Today's training is going to cover the following subjects: HIPAA, high-tech, the Omnibus rule, the breach notification rule, the enforcement rule, and the guidelines as set forth by the Office of Civil Rights. Now, nothing contained in this video is to be construed as legal advice. We are not attorneys, but we will tell you that all of the recommendations and information comes directly from HHS, which is the Health and Human Services, the Office of Civil Rights, the Office of Inspector General, and everything has been updated for the Omnibus rule. Now, I want to remind you that there is criminal liability that attaches to HIPAA violations. However, the Office of Civil Rights will only refer out to the Department of Justice for criminal prosecution where there is intentional, malicious use of patient records, or somebody has used their access to patient records for profit or personal gain. Other than that, we are not talking about criminal liability under HIPAA. So the primary goals of your HIPAA compliance program: first and foremost, you want to protect the privacy of your PHI, protected health information, that is your patient information. Number two, we want to avoid a HIPAA audit, investigation, or compliance review. Number three, very important, your office, your organization must get out of willful neglect. And number four, we want to help you protect your practice or your organization from a breach of 500 or more records. Some of the definitions. DHHS, or HHS, is the Department of Health and Human Services. They are the agency which oversees HIPAA. They work with smaller organizations under HHS, which are CMS, Centers for Medicare and Medicaid Services. They are no longer directly in charge of HIPAA, but they do still get involved because of meaningful use and that requirement to perform the security risk assessment. The Office of Civil Rights is the main enforcement body for HIPAA, and they are, again, under the Health and Human Services. What we're protecting is called PHI, Protected Health Information, and that is made up of two components: IIHI, Individually Identifiable Health Information, and TPO, Treatment, Payment, and Healthcare Operations. So any information that can be directly identifiable to a patient is protected health information, what we're protecting. We also subcategorize PHI into ePHI, going over the electronic protected health information or digital information, and sensitive PHI or SPHI, which is a special class of protected health information that requires additional protections by your office. Malware is what we're going to call all the classes of malicious software: worms, viruses, ransomware, all of the things that can infect or harm your system. Meaningful use are the EHR requirements to get the stimulus funds. Included with them, each stage is a requirement for a security risk assessment. And willful neglect, the conscious, intentional failure or reckless indifference to your obligations to comply with HIPAA. You've had over 10 years to be HIPAA compliant, and the government is now taking a much more serious aspect of enforcing that. So if you're watching this video, you are more than likely the responsible person, and you have one of three different titles. You are either the HIPAA Security Officer, you are the HIPAA Privacy Officer, or in most small organizations, you're just commonly known as the HIPAA Compliance Officer. Again, it's actually two separate jobs. One, the protection of your ePHI or digital patient information. The other, Privacy Officer, is really concerned with the uses and disclosures of patient information. But again, typically we find just one person doing that. And remember, this is not just an additional title that you've been given. You have responsibilities under federal law. That's what this video is intended to do, is to help you understand so you can properly implement those responsibilities. So I'm going to go over some of the responsibilities here quickly. And in the words of the Office of Civil Rights, in summary, risk analysis is the first step in an organization's security rule compliance efforts. Risk analysis is an ongoing process that should provide the organization with a detailed understanding of the risk to not only the confidentiality, but also the integrity and the availability of electronic protected health information. So what does that mean? You need to perform a risk assessment every year or whenever you have major changes to your network or software. That means if you've just recently upgraded from eClinical 9.0 to 10.0, you need to perform an additional risk assessment. Now, what we recommend is that you have an outside agency such as ours come in at least every other year to help you with your risk assessment. And then you can take a year off and do it yourself. But again, it is a constant and ongoing process. You need to develop a risk management plan. So from that risk assessment, you are going to have a list of known vulnerabilities. That risk management plan should show how you're going to resolve each of those vulnerabilities. As a HIPAA compliance officer, you need to make sure that there is a budget for network security. You cannot just go on and be reactive. You must be proactive in your security of your patient information. You are required to have an organizational chart, and that organizational chart should list the members of your HIPAA compliance committee. Now again, we work a lot with small offices, 1, 2, 3 doctor practices, but we go all the way up to large surgery centers. So if you're a small office, it's typically going to be your office manager and your physician and maybe your billing manager if you have a billing manager, and then any outside consultants, any attorneys, and IT professionals. So list everybody that would help you in the event of a HIPAA mishap. We have to have that notice of privacy practices. This is the one place where we see most offices have been diligent in their HIPAA compliance. However, a couple of things that we're noticing, which went into effect September 13th of 2013. If your notice of privacy practices is dated before that, it needs to be updated. Guidelines also now say it must be posted in the lobby or other prominent location in the facility. And if you have a website, it needs to be prominently displayed on your website and downloadable. You must have a set of privacy policies and procedures that describe in detail the patient's ability to access their records and amend their records. You must have documented policies on your security rule or the protection of all that EPHI. So you need policies and procedures for the privacy rule and the security rule. The government strongly suggests that you develop a culture of compliance. This is very important. This means that we are not just going to do our HIPAA training once per year and forget about HIPAA after that. We really need to protect our information year around. We're going to go into that and why it's so important, but that culture of compliance means that HIPAA security is always on the forefront of your practice. Develop a contingency plan. This is a huge requirement. You must plan for all contingency bases. And again, it has to be documented. Part of that will include a facilities security plan, which includes inventory tracking of all of your IT equipment. Another huge responsibility for you as a HIPAA compliance officer is that minimum necessary standard. You need to secure patient information from individuals who do not have a need to know. We will get more into minimum necessary as it is one of the major threads throughout all of HIPAA that you will be responsible for. You must account for specified disclosures of protected health information. Anything outside of your normal operations or outside of TP&O, treatment, payment, and healthcare operations, you must identify and account for, and patients have a right to get a report on those disclosures. You must know and document in detail how your organization uses and discloses patient information. That goes not only for your routine disclosures, but things such as disclosures to coroners, police departments, governmental agencies. All of that needs to be known and documented in detail. You must have a method for verifying authorizations. There are 9 required elements, and your organization must have a way of making sure that before you release patient information via an authorization, that authorization is HIPAA specific and legal. You have to have a sanctions policy for any employees or business associates that violate any of your policies and procedures. Again, this must be documented, and you need to have examples, or you need to be able to show an OCR investigator the sanctions that your office has handed out. You must also, as the HIPAA Compliance Officer, understand and implement the breach notification rule. Again, we will get into this in much more detail, but there are many specifics that you need to know. Training. Training not only on general HIPAA information, but you must train your staff on your specific policies and procedures. Document, document, document. I cannot overemphasize the importance of documenting all of your HIPAA compliance. So now turning our attention to willful neglect. Willful neglect is a big part of the Omnibus rule, and what it states is that you have had 10 years to become HIPAA compliant. In the past, they gave you a pass of 30 days to get paperwork in order. Now, to enforce HIPAA, these minimum mandatory fines start at $50,000, and we've seen them go up to $4.8 million just in the past few months. So what is willful neglect? Well, very simply, it means you have not performed a risk assessment on a regular basis or a risk assessment at all. Number 2, you do not have a complete set, up-to-date, of policies and procedures for the privacy rule and the security rule. The security rule has not changed in the past 10 years, but the privacy rule has, as of the latest Omnibus rule changes, September of last year, 2013. So if your privacy policies and procedures are dated before that, they need to be updated. Not training your staff. If you haven't performed training, you can expect a minimum mandatory fine if you get that call from the Office of Civil Rights. So the HIPAA requirements, I'm going to break them down real easily into 8 steps. First, we have to have risk management. That's our risk assessment and our risk management program. We have to work with our business associates and make sure we have agreements in place and that we have done our due diligence on each of them and that it is documented. Again, we need to make sure we have those policies and procedures for privacy and security, HIPAA specific training to our individual policies and procedures, breach planning, contingency planning, making sure we have all the documentation in place, and system activity reviews, monitoring the activity to our patient information. So I'm going to go over quickly the privacy rule basics. These are the main components of the privacy rule that you must comply with for your patients. So first, all patients have a right to inspect and copy their designated record set. That means that not only the records that your office has created, but all of the records, paper and electronic, that your office maintains on that patient. So if they came from the hospital, they came from another specialist or referring physician, if you have them, patient has the right to access them from you. That you have to required to do that. You are now also required under Omnibus to provide electronic copies of patient information. Make sure that you are not overcharging for medical records. Each state has its own regulations on what you can charge. If you violate that, you will be in violation of HIPAA. You can only charge what your state allows. There are no longer any retention fees or storage fees or retrieval fees. You must just charge postage and the charges your state law allows. Patients have a right to request amendments to their patient information if they feel that it's wrong. This is actually probably a very strong rule that should be followed, because 95% of all medication lists are in error. That's according to recent surveys. So patients have a right to request an amendment. If your office disagrees with the requested amendment, you must send them a letter and inform them that they have the right to put in a brief statement of disagreement. They have the right to request privacy restrictions, who does and doesn't receive their information. And you should take into consideration the patient's best interest in either accepting or denying those requests. Patients now have an absolute right to restrict information from their health plans. This is a very slippery slope for your office. But if a patient comes in and pays you in cash in full for a service, an exam, a test, and they requested that information not be disclosed to their health plan, you must make certain that that information is not given to that health plan. The right to request confidential communications. Again, what's in the patient's best interest? We want to make sure that we understand that they have that right to receive information, maybe at a P.O. box, or get calls not on their home phone but their cell phone. And patients have a right to receive that notice of privacy practices. Your notice of privacy practices should have already been updated for Omnibus. If not, it needs to be updated, and all patients must re-sign, because there were major changes in the provisions of the notice of privacy practices, that they have received the new one. Other than that, you have to renew that notice every 3 years. And patients have a right to file a complaint without retaliation. If they want to file a privacy complaint, you want that taken within your office, not going to the Office of Civil Rights. So make sure you have a process and your employees are properly trained on that process. So we want to avoid a HIPAA audit. How do we do that? Well, we know those patients' rights that I just went over much better than the patients do. But we also have to have a documented minimum necessary standard. This is a key protection of the HIPAA privacy rule. And basically it says that unless we have a medical necessity reason to access or use patient information, we should not be accessing it or using it or distributing it. So we must make sure that we have safeguards in place to limit the unnecessary or inappropriate access and disclosure of protected health information. Why is this rule so important, or this standard? Because without it, you do not get incidental disclosure. Every day in every organization, especially in patient or practices, we have patient information that is going to be overheard by other patients. We have patient information that's going to be heard by staff members who are not involved in that patient's care. Without the minimum necessary standard and incidental disclosure, those would each be HIPAA violations. So having a documented minimum necessary standard is key to your HIPAA compliance. It also means that you, as a HIPAA compliance officer, and maybe as even the owner of the practice or organization, are not allowed to go into patient records without following the same procedures that a patient would. Not even your own record. You must follow the same policies and procedures that a patient would. So again, minimum necessary also means that we have to limit the employee access by their job requirement. That may also mean physical access to the charting room or other areas if that staff member's job function does not require them to be there. Request only the patient information that's needed for its intended purpose. A good example of this is when an insurance plan requests additional records to pay the claim. Do not send them the whole chart if they do not need the whole chart. Take the time to only send them the records that are relevant to that payment. And make sure that you yearly review this policy and procedure. Accounting of disclosures. This is going to become more important as patients suffer more medical identity theft. So you have to track, you have to train your staff to make sure that anything that falls outside of your normal business operations of payment and treatment is documented. Examples would be public policy disclosures, court orders, a breach. A patient has a right to find out about any accounting of disclosures, any disclosures that are made outside of your normal operations going back for 6 years. So have the patient sign a form and give them their accounting of disclosures. You must have a breach incident report. All breaches, no matter how small, must be reported to the HIPAA Compliance Officer. What is a breach? A breach is any unauthorized use or access of patient information. Most common breaches are going to be sending information to the wrong fax number, maybe to the wrong doctor's office. Even though they are another HIPAA covered entity, we must document that incident. In the past, we just asked them to shred it and got it to the right office. Now we have to document that through a special breach incident report that the government now requires. We also need to make sure that we have a patient complaint process. Make sure your employees know to give them a form so that they can fill it out, who that form needs to go to, and make sure that your staff can get all that accomplished very quickly and easily so that you can avoid having the patients go to the Office of Civil Rights and your office can handle any patient complaints. That Notice of Privacy Practices, it has required elements. Make sure you go through these elements to ensure that you are giving all of the notifications that are required. Again, Omnibus changed those notifications, and you must make sure your Notice of Privacy Practices is updated for those. The authorization form must have 9 elements. These include the time frame that the authorization is good for, the specific records to be disclosed, who can receive those records, make sure your patient knows that they can revoke them, make sure that you're releasing information only for authorized authorizations that have been reviewed for those 9 elements. A good example, if there is sensitive protected health information, HIPAA requires that the patient perform an additional step. Every day out in the field, we see authorization forms that say if there's any mental or sexual abuse information, it will be sent along with this with your signature. That is not valid. The patient did not have to perform an additional step to release that information as is required. So be very careful with releasing information. Verify that the authorization form has those elements. Patients have the right to ask for confidential communications. The request must be reasonable. Again, is it in the patient's best interest? Do not ask why. That would be a violation of their privacy rights. So know the privacy rights better than your patients do. Most patients don't know these rights. They're listed in your Notice of Privacy Practices, but patients do not take the time to read that. But when you do have an educated patient, if your office is not prepared, you could easily violate their rights and bring a HIPAA OCR investigation upon your practice or organization. So train your staff thoroughly on these rights, reinforce that training throughout the year, and document each instance of the training and what you trained them to. That brings us to the HIPAA security rule. And they put out the HIPAA security matrix. And as we go through here, we see all of the different standards that the HIPAA rule requires, and we see that there are implementation specifications. R for required, A for addressable. So what does that mean? R required means that that specification is required. A addressable means that that specification is required. Or your organization must thoroughly document why you are not using that standard and what security measures you have put in place in lieu of the addressable standard. So addressable standards must be reviewed, they must be documented, and when possible, they must be implemented. Your organization must have a sanctions policy. You make sure that each employee has read it and signed it. Make sure that it is evenly applied. Document all sanctions, because even if it's a verbal warning, you need to be able to show an OCR investigator that your sanctions policy is not just a piece of paper you have in a binder, but that it is something that is ongoing and that you are always, again, part of your culture of compliance. When there are HIPAA violations, you are sanctioning those employees for them. Make sure to apply them evenly. If you want a disgruntled employee to have a valid HIPAA complaint against your organization, treat different staff members differently, and I can guarantee you of a HIPAA violation. We ask for a lot of documentation because the law requires it. Directly from the Office of Civil Rights, and from our experience, the more documentation you have, the faster you can get that documentation to the Office of Civil Rights, the easier any investigation will go, and the faster it will be resolved. So, 10 things you should know about healthcare IT security. First of all, protected health information is the prime target of cyber criminals. You have to understand the value of your patient records and think of each patient record as being worth $5,000 or more to the cyber criminals. In a recent training, an office staff member told me that she was the victim of medical identity theft, and that using her information, they were able to obtain an $8,000 refund check from the IRS. That doesn't include Medicare fraud that might be useful with that information, and also credit card fraud and other forms of banking fraud that can be used with the information that you have in your computer systems. Healthcare breaches are increasing, and so are the fines. We just had a recent fine of $4.8 million, the largest ever, for a relatively small breach, 6,800 records. So be aware that breaches are increasing and you have increased liability. So last year there was a 6% increase in the reported data breaches. Identity theft is up over 13% over last year. So understand that you are more at risk now than you were yesterday. Number 8, most breaches occur due to lack of training or employee mistakes. So training is a key component in your culture of compliance. Number 7, a breach requires specific procedures by your office. Even without fines being imposed, the cost to respond to a breach can be astronomical. First-class letters, hiring of attorneys, perhaps having to provide identity theft protection for your patients. So understand that breaches are very expensive and are worth the time and effort and resources to avoid. Patient information must be protected by a commercial grade firewall, routine patching, and network monitoring at a minimum. Most offices we go into, again, we work primarily with smaller offices, but most offices that we work with are protected by a residential grade firewall, the firewall that came on the router that your internet provider provided. That is not adequate. You need to have that commercial grade firewall, something such as a Sonic Wall, WatchGuard. Talk to your IT professional. Security is an ongoing process, and you must budget for it yearly and have your qualified security or IT professionals review that budget with you so that you can be proactive, not reactive. Remember that patient information is located everywhere and must be protected at all times. So at a minimum, any mobile devices need to have remote wipe software and must be password protected. Number 3, get compliant today. You've had 10 years to follow HIPAA. Now, non-compliance carries that minimum mandatory penalty of $50,000. Number 2, Encryption is your safe harbor. Encryption is your key to compliance. So make sure that you encrypt all data today and encrypt all devices and transmissions
Again, if
tomorrow.
It's not encrypted,
What I mean by that is get your primary data encrypted as quickly as possible and budget for or plan for encryption of all devices and transmissions as soon as possible. As the HIPAA Compliance Officer, you are responsible for answering all questions about your organization's HIPAA compliance in detail. You are the person designated to know and implement your HIPAA compliance policies and procedures. And again, you're the one that needs to know all that information in great detail. Now we're going to turn our focus to your business associates. And what I want to know is, are you giving access to your patient information without performing any due diligence on that company? Are they HIPAA compliant? Well, you can ask any company that you're working with, any business associate, are you HIPAA compliant? They will all say yes. You could then ask them, when was your last risk assessment? Well, what's a risk assessment? Or we're not required to perform risk assessments. So you will find that probably 90 to 95% of all of your business associates are not HIPAA compliant, and they will sign your business associate agreement because they know they have to, or federal law requires that you terminate their agreement. But when you ask them for due diligence, they will be at a standstill because they don't know how to answer because they're not truly HIPAA compliant. So what does it mean for a business associate to be HIPAA compliant? Well, they have to perform a risk assessment yearly, just as you do, to the HIPAA security rule standards. They must implement those standards. They must train their employees on the HIPAA security rule, privacy rule, and the business associate agreement that you have with that organization. So pretty much the same as you are covered under HIPAA, they are covered under HIPAA. And as the HIPAA Compliance Officer, and your organization is the owner of that patient information, you must verify that they are HIPAA compliant. Business associate agreements need to be detailed, and you need to spell out in detail how any breach is going to be handled. If you accept their common business associate agreement that they will push to you, they will give themselves 60 days to notify you of a breach. In many states, you only have 45 days. The HIPAA requirement is 60 days. So even if they took all 60 days and reported to you under those contract terms, HIPAA says that you have 60 days from the date that the breach was discovered, not by you, but by your business associate. So you are already in HIPAA violation because you have not performed the required breach response because you allowed in your business associate agreement too long of a time. So make sure you know how long they have to notify you. I recommend no longer than 7 days, not 7 business days, but 7 days, because you have a lot of work to do in a very short period of time. Also, as I mentioned earlier, breach notifications are very expensive. So make sure that your agreement talks about who's going to pay for all of that compliance. Now I turn to contingency planning. And this is a huge part of the HIPAA security rule. And that basically means that you need to have policies and procedures to respond to an emergency, whether that's a fire, vandalism, system failure, hurricane, all types of emergencies you need to plan for. That means you need to have a data backup plan, a disaster recovery plan, how you're going to get back up and running afterwards, how you're going to be able to access patient information during the emergency, testing and revision of those procedures, and making sure that you have a data criticality analysis of your network components. So your contingency planning is not optional. Again, it's required for both covered entities and business associates. Your data must be recoverable. You must get your data off-site, and if it's going off-site, it must be encrypted, or you have an extremely large exposure. You must back up your data frequently, And again, you must always have safeguards in place, even through times of emergency and getting back up and running after an emergency. And make sure that you are encrypting or destroying all information. So again, you must have those written policies and procedures. You need to test that back up and realize that the monetary penalties for non-compliance on the subject of contingency planning can be severe. Now we're going to go to some lessons learned and guidance directly from the Office of Civil Rights. As with most government agencies, they are very good at putting out reports and guidance. There is an enormous amount of materials on the internet directly from the Office of Civil Rights, the Office of Inspector General, Health and Human Services, Centers for Medicare and Medicaid Services, and we have gone through that and want to give you some of the things that we can tell you from that guidance. So first of all, your employees are not expected to know every policy and procedure by heart, but they should have easy access to your policies and procedures. So we recommend you put them online or put them in a spot that is available to all staff members. Again, I will harp again over and over about documentation because documentation is the key to your compliance. Everything pretty much must be in writing. If you handle or have psychotherapy notes, they must be kept separate in order for them to be protected from patient inspector copy request. If you take session notes through therapy and put them in with your traditional records, they lose that special protection that they have. So you need to make sure that they are kept away from the designated record set. Keep them out of the EHR. Do not send them to offices that may scan them into their designated record set. Again, patients have a right to request amendment. You do not have to accept that request, but you must put in the record a brief statement of disagreement if the patient requests that, and you have to notify them of that right. Business associates are a major focus. Make sure that not only do you have a business associate agreement in place, but that it has been updated because, again, Omnibus changed the definitions. It changed the requirements and what needs to be in your business associate agreement. So go ahead and make sure that that business associate agreement has been updated. So if it's dated before September 13th of 2013, go ahead and implement a new Omnibus up-to-date business associate agreement. And again, make sure that you verified at least the 3 willful neglect, that they have had a risk assessment performed within the past year, that they have a full set of security and privacy policies and procedures, and that they have trained their staff specifically to those policies and procedures. Document that. We also know that you need to have job descriptions with the access level for each employee, and that at least once a year you should update those employee names and be able to present that to an OCR investigator. You must have robust measures in place to review system activity. System activity is basically all of the access to your patient information. And even if you are cloud-based, you can run reports that show how your staff and which members of your staff have accessed patient information. More about this later. So you must review the records and audit logs of your system activity, and you need to determine how you're going to do that, and again, document the methods that you're going to use. Are you going to use hardware, automated software, or manual reviews? The content of your audit records needs to establish what type of event occurred, when that event occurred, where it occurred, and the source of the event, along with the outcome of that event, how you handled it, and the identity of any user or subject associated with the event. So we need to know a lot of information from our audit logs. If you have a certified EHR, part of their certification process is to make sure that you have the capability to produce these type of audit records. Now, a breach, again, has changed. This is probably the most dangerous part of HIPAA for your compliance now, because a breach is considered to be discovered as of the first day it was known about or should have reasonably been known to have occurred. That means you have to be monitoring that system activity, because in many cases, that will be the only way you will know if your information has been breached or otherwise compromised. So the Office of Civil Rights says you cannot put your head in the sand and say we didn't know. We have to have that robust auditing program in place to look for suspicious and unusual activity to our patient records. We also know that we need to have automatic patching of our software. Patching is the process by where known vulnerabilities get corrected by the manufacturer of that software and are as important, if not more important, than the antivirus software that you have. Patches, although most computers are set to automatically apply them, do not always get automatically applied. Sometimes there are glitches, and security patches can sometimes build on each other. So without one security patch, you may have multiple security patches that don't get applied, leaving your system very vulnerable. So check with your IT vendor on how you can monitor the patching of your network. Very important, and again, something very overlooked by most offices, and that is that every employee must have that accesses electronic protected health information, must have a unique identifier. That means a separate username and password for the Windows or other operating system that you're using, a different unique identifier for the EHR. If you have a separate practice management, we would need a separate one there. And if you have any old systems that are still in the office and being used, again, every system that contains protected health information needs to have unique identifiers. Otherwise, audit logging is ineffective because you won't be able to identify who accessed that system, even if it's only the Windows system and not going directly into the patient records. Now we turn to the breach notification rule. And all breaches must be documented with a risk assessment. The federal law puts out 4 questions that must be answered, such as who saw the information, what was the information that was released, and what has your organization done to mitigate any harm to those patients whose records may have been breached. And again, you need to understand the definition of an omnibus breach. They changed the rules in the definition. A breach used to require harm to those patients. Now a breach is simply the unauthorized access or disclosure of patient information. A big change. So you must know how to respond to each of the breaches that occur. And the biggest thing here is the number of breaches and your requirements there. You must have that documented plan for your breaches. So we just got the latest report from the Office of Civil Rights stating the reasons for breaches of 500 records or more. And since they've been doing these reports, as has always been the top number or the top reason, it's been theft or loss of a device containing patient information. Very easy. Encrypt any devices that contain patient information, and you will safe harbor yourself out of the breach notification rule. Second most common reason was unauthorized access or disclosure, either by accident or intentional purposes. Number 3 now is hacking. This was not in the top 5 of the reports in the last report to Congress. So that means the cyber criminals have increased their attacks on the healthcare industry, and they are being more successful. So you must have security measures in place. And then number 4, rounding out, is the improper disposal of patient information. So making sure that if we turn in copiers that are on lease, that if they have hard drives, that those hard drives are wiped or removed before returning, that any discarded IT equipment is properly disposed of and documented by the office. So here are some of the things that this report showed that practices and organizations were doing to mitigate the breaches that they incurred. So what I'm going to tell you is, let's not be reactive, let's be proactive. So make sure those policies and procedures are updated. Make sure that you have good physical security measures. We worry about our firewalls and our passwords and all that good stuff, but many times we forget about security measures. So we need to have an alarm system on the building. If there is unauthorized access, we need to know about it. Retraining of staff. I would tell you that most offices do not do an adequate job in training their staff as to HIPAA. Do not rely on your OSHA person to train you on HIPAA. They are not experts in HIPAA in most instances, and do not give you a full and complete understanding of the patient's rights and how your office can avoid and maintain HIPAA compliance. So here's one that you don't want to have to pay for: free credit monitoring services for patients. This is sometimes a requirement in the agreement that OCR has with the offices in the event of a major breach. Encryption, do it before rather than after. It will save you more money and time than it will cost you by far. They started imposing sanctions after a major breach. We want to do that beforehand. Many offices weren't changing passwords. Now here's something that shows the importance of having good, complex passwords changed every 90 days. 76% of all network intrusions are accomplished through password attacks. Either what's called a brute force attack, where they go through every password combination, or tricking your employees into giving them their password. So passwords are an important part of your HIPAA compliance. Use complex passwords, 8 characters in length, upper and lowercase with numbers. Change them every 90 days. New risk assessment. Make sure you've got a good risk assessment and risk management plan in place. And here's one that I take particular note of. They created more detailed provisions in the business associate agreement for the protection of patient information. I haven't talked about it yet, but we have a HIPAA compliance kit. We also, as a service, provide our business associate agreement for free download from our website. The reason I recommend ours is because it is the most detailed business associate agreement that we have come across. Even those created by attorneys do not list each of the standards that your business associate is responsible for. So our business associate agreement lists all of the things that HIPAA requires. They are covered by them even if they are not in this agreement, but we use the agreement as a training tool for the business associates so that they fully understand these provisions. So don't do it afterwards. Use our agreement and do it from the start. So again, for a breach, time to encrypt is now. What you see on the right-hand side of the screen is encrypted text. So it's more than password protected, it is scrambled. Start with your mobile devices, then servers, and even the workstations that only access patient information are going to need to be encrypted. Don't forget, if you're using email and text messaging with patient information, that those need to be encrypted as well. So HIPAA is an ongoing job, and an OCR auditor will always ask for your risk management strategy. In our HIPAA compliance kit and our services, that's what we call our step-by-step compliance plan, because we have an 8-step process that simplifies your compliance. Make sure you are actively working on this plan. I recommend that, of course, you document your progress and even the time you're spending doing your HIPAA compliance. And again, make sure all employees are properly trained. When you hire a new employee, make sure that they have initial training and then get trained fully within 30 days. Our HIPAA compliance kit gives you these documents. So some of the hot buttons from the Office of Civil Rights, some of the things that they are looking particularly at. And again, a lot of this is going to be repetitive, but that's intentional because I want you to understand that this is what you need to have in place. So we have a risk assessment and risk management. Got to have those reports, got to work those reports. Business associate agreements with your due diligence is very important. Page 8 of our free business associate agreement asks the questions that you need to have answered so that you can have them documented and in your office. Compliance needs to go all the way down to the workstation security level. That means strong passwords, patch reviews, and other reviews of your even workstations that you have in your office, not just the servers and the firewall, but security needs to flow all the way down to the workstation. Training, make sure you have full documentation that your staff was trained and that you have at least the slide deck or the information that your staff was trained to. Minimum necessary. If you do not have this documented policy in your office right now, go on the internet, type in minimum necessary policy, you'll find one, get that and modify it for your practice today, because otherwise you do not have incidental disclosure and you are committing HIPAA violations every single day. Contingency planning is a must. We have a very templated document in our kit that allows you to quickly and easily put together a contingency plan based on the HIPAA security rule requirements. And system activity review. This is the one place we see every other HIPAA vendor out there lacking in, and that is putting together a simple, easy process for you to meet this requirement. This is probably the number 2 hot button of the Office of Civil Rights, and that is making sure that you are monitoring that activity to system resources and information, in other words, that patient data. We have a 7-page report. It took us 6 months to put this together to help you simplify that process and make it easily understandable for you to perform this required activity. Make sure that you know how to respond to breaches, that you've got documentation in place for it, that you know that major 500 or more has specific requirements. Those of 499 or less also have requirements. Make sure you are able to understand and would be able to fully explain these responses that you have in place to an OCR investigator. Privacy rule. Again, we know that they are going to ask you in detail about your uses and disclosures of patient information, not only for your routine disclosures, but also to things such as governmental agencies, coroners, the police, and many other places where information may need to be sent or reviewed. So, kind of stepping back a little bit, I do want to remind you that the patient is at the top of our process and that we should never let security trump patient preference. The patient is in control. And another important aspect of HIPAA is that HIPAA should not get in the way of the best interest of the patient. These are quotes directly from Leon Rodriguez, the current director of the Office of Civil Rights. They really want you to know how you can and cannot use patient information. And many healthcare professionals use HIPAA to block all patient information going to anybody other than the patient instead of as a filter. So understand that in most instances, you can give out not specific, but general information as to condition and other information and location, but not get into the specifics. And you can do that unless the patient tells you otherwise. Again, HIPAA is all about documentation. HIPAA requires that all of this documentation be kept for 6 years. That includes your audit log reports. That includes those audit logs. Most audit logs, because they are tremendously voluminous, are not stored for a long period of time. Make sure your IT professional has in place a method for you to store 6 years worth of those records, and that information is encrypted, because audit logs do contain a lot of protected health information. Be ready for your HIPAA audit. I can guarantee more audits, more investigations, more compliance reviews. This is a recent report from the Office of Inspector General. It states that the OCR, the Office of Civil Rights, did not meet their federal requirements critical to the oversight and enforcement of the security rule. In other words, the Office of the Inspector General has reported to Health and Human Services that the OCR is not doing enough auditing of patient records and how they're being protected by organizations. Now, they have put a lot of compliance tools out there. So review the OCR audit protocol, which is available at the ocr.gov website. You can also Google and find information on the NIST, which is the National Institute for Standards and Technology. That is the government's IT company, and they've put together a HSR toolkit, health security rule toolkit, to help you perform a risk assessment of your practice. It's not a full risk assessment, but it's very good guidance. It's an excellent tool to track and keep all of your documentation in, but it is very time consuming. They have also recently put out, the Office of Inspector General, a security tool, again, to help you with that risk assessment. Not a full and complete risk assessment, but a good start. And again, we have the HIPAA Compliance Kit, and I'll be giving you the web address for that, but the HIPAA Compliance Kit helps you through all of these processes in an easy to understand process. Beyond HIPAA, but related, remember that you are responsible for Medicare fraud and abuse training every year to each of your employees, that you must have an employee manual that is up to date. The Department of Labor is going after both restaurants and physician practices for overtime violations. Make sure you have an employee manual that addresses this subject and others. And make sure that you are performing PCI compliance. That's the compliance for your taking of credit cards. You must yearly fill out a set of forms so that you are not charged non-compliance fees by your credit card processing company. Now, the real cost of HIPAA and a HIPAA violation is not the fines. It's the loss of trust between you and your patients. A major HIPAA breach is going to require that you notify the local media. You are going to be the top news story. Maybe not even just locally, but maybe even nationwide. That loss of trust between you and your patients is difficult to recover. And most practices have spent many, many years building a reputation within their community. If you have a breach of your patient records, you are going to suffer a loss of that reputation that you've worked so hard to build up. So those are the real reasons that we really do, as medical practices and business associates, want to protect that patient privacy. HIPAA is the federal floor that we should implement to help protect that patient privacy. Again, something as simple as making sure we're using complex passwords and changing them every 90 days can help prevent as many as 76% of all of network intrusions, or at least reduce your risk. So I want to thank you for your time today. I do want to tell you that we have an additional video for you to watch. I know we've spent about an hour here today, but please watch our video, You Are Under Attack, Comprehensive Cybersecurity Program. I do feel and expect that many of the things that we talk about in this Comprehensive Cybersecurity Program will be a part of the new HIPAA security rule. It's not been changed in 10 years. It is under review. There is a good chance that the President's cybersecurity framework could be implemented as the new privacy and security, or the new security rule, and we go over many of those requirements in this cybersecurity program. Again, we have the HIPAA Compliance Kit, which includes not only a regulatory binder for you to maintain and store all of your HIPAA compliance information, but also the HIPAA Compliance Kit, which is the risk assessment business associate agreements, policies and procedures, training, breach plan, contingency plan, documentation, system activity reviews. It's all combined into one simple and easy to use system so that you can easily meet all of your HIPAA requirements. So if you do have HIPAA questions, if you do need our services, please contact us. Our information is listed right here. And we thank you for your time today.